Hi, everybody. It's Liz here, and this month of July, we are talking about falls and how to prevent them for our seniors. Now, where you want to start is what can cause a fall. Falls prevention can encompass everything from the home, so looking at lighting, footwear for our clients, uneven flooring, uneven pavement outside of their home, stairs. So the stairs have to be intact. They have to be able to manage them on their own. And then you've got your lift. So if the lift isn't operating properly, got to keep an eye on that, make sure it's charged up and functional. You can also look at falls out of bed. So if you have a client that has a tall bed and they're a small person, making sure that they have the right bed height is always important, and a bed rail there for additional support. During the night, falls can happen when they're transferring to the bathroom. So having a urinal for gentlemen if they're up a lot at night, or using a commode for our ladies, having it put in the proper place in the home, so right next to your bed at a 90 degree, so that they can easily transfer during the night. And again, make sure the lighting is good at night and they have proper footwear. Slips can happen very easily. And wheelchairs, making sure the brakes are on. Now that all kind of circles back to cognitive function as well. If you're dealing with a client who has a lower level of consciousness, or a dementia diagnosis, or any sort of memory issues, as well as any acute infections, those can also very much increase our chances of having a fall. Our seniors, 35% of seniors over the age of 65 will often have a fall. That's the statistics in Canada. And 68% of those 35% will end up requiring assistance and actually have a decline in their health following that fall. And so that's what we're here to hopefully prevent. When you think of their intake, if you have a senior who has a poor intake of food, so their nutrition is low, they're dehydrated. Dehydration can cause issues with blood pressure, and dizziness can come from that. Then there's the balance issues also caused by that. Making sure that they're hydrated well, that our clients and every senior out there has the mobility supplies that they need in their home. So having a walker close by, their cane, and again, the wheelchair with the brakes on close by. Managing those health conditions such as the dehydration is, relatively easy. So having a bottle of water at their bedside that they can always have a drink of. Making sure they drink a lot more in the morning, because our clients like to not get woken up during the night to go to the bathroom. So a lot of them will skip drinking after lunchtime because of that. And that stands in the way of them as well getting better. Managing any chronic pain. Having diagnostics and the physician on our side also helps. So being able to treat the medical conditions appropriately. The medications themselves can actually cause some issues. So making sure that they are taking their medication regularly. And if you do notice that they're struggling with, ambulating well, or if they have some major changes in their ambulation, then we need to investigate, was there a fall? Is it from the medications? Has there been a dosage change? Anytime there's a new medication or an increased dose of a medication, the first thing that we want to look at is this a cause for concern? Is this the potential cause of why this fall has happened, or the balance issues have happened? And then we need to talk to the doctor. So if that happens, phone the office, make sure that you get a hold of myself or one of the other nurses, and then we will mitigate that as best as we can. Vision concerns as well. So having poor vision, no vision, those sorts of things. Navigating the home can be very difficult. So seeing depth is hard. Using vibrant colors to accentuate where edges of tables are, or the edge of stairs are, those sorts of things are what we do when we're out in the community. So you'll see a bump on the road that's been painted yellow, and that's why. So high contrast colors can actually help to show somebody where the edge is, or if they need to get their medications, putting a bright color on the top of that can help with vision impairment for finding that. Neuropathy for diabetics, so they lose sensation in their feet and then they end up falling because the sensation is lost and they can't feel where the floor is. The biggest indicator that somebody will have a fall is that they've already had a fall. So if you go into a home and there's listed in the care plan that they've had previous falls, that's the biggest indicator. So you need to take a look and make sure that if they have had a fall, there's nothing in the home that you can see that would actually be a possible risk factor. So when myself and Darcy go into the home, we'll take a look through the home, and there could be items brought in, or we might not see something, and we need your set of eyes out there in the community with their with the idea that a senior could need a little bit of additional help. So take a look at their footwear as it wears down. Take a look at their home. Take a look at their back steps. Garbage is usually a difficult one to manage to get into the garage, so offer them those sorts of supports as well. If you have concerns for any of our clients, if any of these things ring a bell, or you're starting to think that maybe you've seen a few of these signs or some decreased imbalance, those are something that you need to bring to the office, and then I will help you out as best I can. I'm hoping to do an in-office orientation around this, so hopefully coming up in the future we'll have a little bit more hands-on falls education. So stay tuned and hang in there. Thanks, guys. Bye.